Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
It's interesting when we talk about arthritis that many times we overlook gout, and gout actually is one of the oldest known and most common forms of arthritis. In the world of arthritis, we usually focus in on osteoarthritis as well as rheumatoid arthritis, followed by psoriatic arthritis, which includes skin involvement along with the manifestations that occur within the joints. But gout is an incredibly painful form, and I want to talk about that in some detail today so you have a better understanding of kind of some of the things that can exacerbate gout, and then things that you can be doing if you yourself have ever suffered an acute gout attack, or if you have a friend or family member or coworker, maybe you can give them a little bit of insight as to how to better manage their gout. I am Amanda Williams, MD, MP8, and today I want to focus in on some of the most characteristic factors that go along with gout. And what we know is that this is incredibly painful inflammation of one or more joints of the extremities. So oftentimes people think about the big toe, and that is usually the most common place that people will suffer an acute attack of gout. And what happens is it creates these nodules within the soft tissues. And this can create a lot of discomfort. And if you've ever talked to someone who has had a gout attack, they will tell you they just want it to go away. And they usually turn towards things like anti-inflammatories, and they try to, even apply ice and elevate. And sometimes that just doesn't work. For many people who have had more frequent gout attacks, sometimes they are actually put on prescribed medications by their physician to try to regulate the uric acid, because that is the primary risk factor for gout, is elevated levels of a metabolic byproduct that is known as uric acid. And so the uric acid is circulating in the blood, and if that level gets to be too high, then this is a real issue, and this is what we call hyperuricemia. And when we realize someone has hyperuricemia, then we have to watch out for the potential of a gout attack. Now, when we look at foods that are known or linked to gout attacks, we certainly look at things that are purine-rich foods, and I'll talk about those in a moment. But we also have to look at how many people throughout the country actually can suffer from high uric acid levels. And hyperuricemia is estimated to affect over 20% of the U.S. population. So over 20% of people walk around with elevated uric acid levels, and then they have that potential that maybe one of these high purine foods can really kind of set this whole flood of painful inflammation into motion. And so this is why you really have to be cognizant of the foods that you're eating. We know that high purine rich foods include things like red meat and shellfish. When they used to always talk about people going out and having, the diet of kings, where they'd have steak and lobster, and then, with the butter sauce, and then they'd have a glass of wine, and then they'd go home, and then the next day they have this huge flare up within their, generally speaking, it's usually in the toe, and really, really painful that they can't even put any pressure on it and have a difficult time even walking. So we know that certain foods definitely are linked to this. So we know that the high protein foods such as meat and pork, lamb, all of these certainly are problematic, but we also recognize that alcoholic beverages can also increase blood uric acid levels, which is going to be an additional risk factor for a gout attack. So remember, if 20% of the U.S. population at any given time is walking around with elevated uric acid circulating in their blood, and then they go and they have certain foods that can then precipitate this, then we know that we have some serious issues. There has also been a positive association between fructose and gout. So this is another area that you certainly want to make sure that you're cognizant of if you have that tendency to have elevated uric acid. And you would know this by having your uric acid levels tested when you do your annual blood tests. But things like juice, for example, orange juice, certainly can, elevate that uric acid level. So these are things that people need to be aware of and make sure that they avoid. So this is just a key little point to make, because sometimes people think, oh, well, maybe I should have, things that are high in vitamin C, which we know can be very helpful. We know that vitamin C significantly reduces uric acid. And the way that it's doing this is it inhibits an enzyme known as xanthan oxidase. So if you think, oh, okay, well, vitamin C is good, maybe I should just drink a ton of orange juice. No, because we know that fructose actually can be an exacerbating factor to that. So you have to know what you should be doing and what you shouldn't be doing. So there's a few different lifestyle and dietary modifications that someone who has a history of gout attacks or has a history of having elevated uric acid levels needs to be aware of. So, exercise is definitely important. The more weight we carry, the higher association with having elevated uric acid levels. Certainly limiting that intake of red meat, consuming lower dairy products is certainly going to be important. And to make sure that you are consuming more things in that Mediterranean diet, because those are going to be better in terms of down-regulating that uric acid level in the body. And obviously reducing alcohol intake and any of those sugar-sweetened beverages, which we know Americans absolutely just love. So we know that this is a problem. I have talked to so many people who have developed gout, and they get it one time and say, oh my gosh, please let me never get this again. What can I be doing? So first is the dietary changes, the exercise, but they have to be aware of, what uric acid actually is, because that's what's depositing within those tissue spaces. And uric acid is this metabolic waste product. And when we get too much of that in the bloodstream, this is when the problems start to arise. And we certainly know that high uric acid levels have also been, indicated in problems with cardiovascular health as well. So we don't want to have high uric acid levels. And the fact that 20% of Americans do have this is certainly a problem. We also recognize that, the high uric acid levels are also a risk factor for the development of even bladder stones and kidney stones. So this is another reason to make sure that we are making those dietary modifications. Elevated uric acid levels certainly are an individual risk factor when it comes to cardiovascular disease, as well as, coronary events such as, heart attacks and heart failure, strokes. We do see, generally speaking, high uric acid levels in people who have these cardiovascular issues, including even hypertension. So it is really important to make sure that you are doing the right things in terms of diet, in terms of exercise, cutting out the sugar, cutting out, high amounts of red meat and shellfish. All of these things are things to be notated and to avoid having to be put on, a very powerful medication such as allopurinol, which is going to be the prescribed drug of choice when it comes to trying to prevent gout attacks. And that, once again, is targeting that xanthine oxidase. It's inhibiting that. But I had also mentioned that vitamin C does a lovely job of targeting xanthine oxidase. So when we talk about what we should be doing in terms of our diet, we want to incorporate vitamin C. into a supplementation routine, and ideally at least 1,000 milligrams of vitamin C every single day to help with more of that normalization of the blood uric acid levels. There are other things that you can start to incorporate. Cherries, for example. We know that cherries are a traditional kind of turn to treatment when it comes to gout. And the cherries themselves are very rich in all of those powerful polyphenols, those antioxidants. But we also have been able to see that when they give cherries or cherry juice to people who are having a gout attack, it actually lowered their uric acid levels within just a few hours. But they also recognized that it lowered C-reactive protein levels, which is a marker for inflammation. So this just shows you just what those polyphenols and those antioxidants derived from the cherry are actually doing. Now, interestingly enough, coffee has been shown to be very beneficial in terms of helping to create better balance in uric acid levels. They actually found that people who consumed higher amounts of coffee on an everyday basis had a significant reduction in their risk for the development of gout. So they were looking at people who drank 1 cup per day up to 4 cups per day and even higher, and the people who drank higher amounts seemed to have a much better way to reduce the uric acid levels. Once again, they have found that the coffee, similar to vitamin C, has this natural way to inhibit xanthine oxidase. And it's that xanthine oxidase that we need in order for that uric acid to go up. So if we can inhibit the xanthine oxidase, then that uric acid level will flip and go the other way. Now, B vitamins is also another area of interesting research with gout, and they have actually found that folate in particular is a significant player in this regulation. So for those who have had gout and they look at their folate levels, those who have gout attacks have higher uric acid and lower folate levels. So they have found that giving them folate on a regular basis also was helping to support all of this. So all of the things in terms of the diet that are anti-inflammatory foods, so high antioxidant foods coming from fruits and vegetables, and those powerful flavonoids, they do so much. So when we think about what we can be doing in terms of our nutritional supplementation each and every single day, this is where I like to kind of hone in on things like your vitamin C. But we also have a really lovely formulation called Uric HX. And in the Uric HX is a combination of chancapedra, it has potassium citrate, as well as celery seed extract. And this has been shown when we combine these 3 different nutrients together that it provides a lot of support in terms of, once again, that regulation of uric acid processing in the body. So this is another option in terms of daily supplementation. So the dietary changes, the lifestyle modifications in terms of exercising, having vitamin C, 1,000 milligrams at minimum per day, including in the Uric HX, and then we can look at those high polyphenol formulations, things like the Reds HX, the Greens HX. I even include in the Beets HX. When you look at foods that you're supposed to avoid, beets, like whole food beets, oftentimes are the foods that you should try to avoid during a gout attack. However, when we look at the betaine and the beetroot extract, the actual polyphenols, that can be very helpful because it's helping to enhance that antioxidant effect. So I look at the Beets HX formulation, I say, okay, well, we get the powerful betaine and we get the many antioxidant benefits that go along with that. So while we're not eating whole food beets, the actual extract can be beneficial. Plus, we get that tart cherry extract, and we certainly know that the cherry extract has been shown time and time again. So different foods can be different when we're looking at them in a whole food setting versus an extracted form. So obviously, cherries we definitely know are beneficial. We know that any of the, fruits that are high in vitamin C, eating the whole fruit, not the juice. So keep that in mind. So if you want to eat an orange, that's fine, but not the orange juice. So these are the things that we certainly want to be cognizant of. Now, another area that I like to enlighten people on when it comes to gout attacks is to add in, at minimum, a multivitamin, because we want to make sure that we're getting adequate folic acid, or the folate. I personally would advise the methyl B. So you're getting that activated folate. You're getting the methylfolate. So if you have a history of gout, adding in that methyl B formulation really gives you a lot of full spectrum coverage of those B vitamins. And we know that folate plays a critical role. So we want to make sure that we're always maintaining healthy folate levels. So there's a lot of different things. Most of it comes down to lifestyle modifications, really changing up the diet. And we know that a standard American diet certainly sets people up to more frequent bouts of potential gout attacks. So having foods that adhere to the Mediterranean diet certainly is going to reduce that risk, which is why, once again, when we look at the diet that is advised to those who have gout, it is mimicking that Mediterranean diet, having, the vegetables, having, seeds and nuts, things that we know are incredibly supportive to maintaining healthier uric acid levels. And at the end of the day, you don't want to ever have to go through a gout attack. So making these adjustments now is certainly beneficial and will be long lasting. So remember, uric HX, that combination of the different nutrients, vitamin C, methyl B, changing the diet, exercise program, and incorporating in a high polyphenol formulation such as the Reds HX would be incredibly advantageous, or even the Beets HX. So that is all that I have for you for today. I just want to thank you so much for tuning into the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts, or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health podcast.